Thank you, Evan. We are live. So as a reminder, I am going to start the recording. I'm just waiting on that to tell me it's good. Okay. And so now it is started to record, and by being on the meeting, you are giving consent to be recorded. And as a reminder, we are being live streamed via the Health Department's YouTube channel. Just as a reminder to mute your line if you are not speaking, and when you do speak or motion, please ensure that you state your name first. And then also as a reminder, all votes should be conducted by roll call vote. All right, and with that, Paige, you can go ahead and call the meeting to order.
Okay, it is 5:33 and I'd like to call the meeting to order. Can I get a roll call, please?
Paige Toth.
Here.
Vivian Goodman.
Here.
Mary Jane Linton.
Here.
Phil Tibbs.
Here.
Candy Clevenger. Jan Hack. Dr. Jerger.
Here.
Sue Krause.
Here.
Dr. Meningati. Dr. Patterson. And Laura Zimmerman.
Okay, thank you. We had the agenda sent out, and I would request a motion to approve the agenda topics. Brandy, is there anything additional that you want to add?
No, thank you.
Okay. Can I get a motion, please?
Motion to approve, Vivian.
Second, Phil.
And a roll call vote, please.
Paige Toth.
Approve.
Vivian Goodman.
Approve.
Mary Jane Linton.
Approve.
Phil Tibbs.
Approve.
Dr. Jerger.
Approve.
And Sue Krause.
Approved.
Okay, Brandy, is there any public comment today?
There is not any public present, and we did not receive any public comment via email either.
Okay, thank you. The previous month's minutes are in your packet as well. If you've had a chance to review those, can I get a motion to approve?
Motion to approve, Brett.
I second, Mary Jane.
And a roll call vote, please.
Paige Toth.
Approve.
Vivian Goodman.
Approve.
Mary Jane Linton.
Approve.
Phil Tibbs.
Approve.
Candy Clevenger.
Approved.
Dr. Jerger.
Approved.
Sue Krause.
Approved.
And I think that's all.
Thank you. How about communication, Brandy?
So just a little bit of an update. Of course, we'll do a COVID-19 update, and then building wide, everybody's continuing to work very hard on essential services. We have had some audits and reviews. Those are going well. You probably saw in the division reports, there's been some major changes in some of the areas. Of course, we've talked for several months about the implementation of IWIC, which is going well. And then we also are in the midst of the implementation of our new time clock, which, if you recall, was a recommendation from our DHS review last year about timekeeping and just ensuring that we're keeping things as accurate as possible for the exact times that our employees are working and the billing to grants. So that has gone live with all employees, and admin has been very busy in getting that set up and also answering a lot of questions as they have come up with our staff. It's quite a feat, and of course, while our staff are doubled right now in size, it's an even bigger undertaking. So very excited to get that done. It's not a good time for it, but it had to be done. So glad that it's going well, and we're taking it day by day with that. Every division has, like I said, not only been holding their essential services, but also continuing to help with these COVID-19 vaccination clinics that we are holding. And you have probably seen the announcements that have gone out. We are holding those very regularly now as we get vaccine. This week, Macon County, outside of the pharmacies, it was about 2,000 doses. And so we kept 600 of them, and then they, shared the others with the provider. So this Thursday, we're having a mass vaccination clinic out at the Decatur Conference Center. So that'll be one of the bigger ones that we've done, but we are doing clinics out at Richland Community College and also here in our building for groups of about 200 or 300 people on a given day. At this time, because supply is so limited, we have been able to pretty much get most vaccine out within one day. We have been doing some outreach clinics or specific clinics. So there have been homes for people with developmental disabilities where they've been able to come to our office and get vaccinated on a separate day. We also have worked with dialysis centers and patients to ensure that they're taken care of where they're at, so they haven't had to come to a different location. We also have been talking about taking vaccine as we get more out to places like senior high rises, African American churches, and trying to ensure that we are achieving equity, accessibility. We're also making sure that we are planning ahead for as vaccine supply grows, that we not only could handle that in our larger vaccination clinics, but that we also are doing more targeted outreach to the populations who have been disparately impacted by COVID-19. So if you have any ideas for us, we're definitely open to those. Unfortunately, right now we're a little restricted because of the amount of vaccine that we're getting, but we are ready. We're excited. We've been contacted by a lot of different partners in the community. So we're excited for when we can start doing that, hopefully in the next couple of weeks here. And then some other things that have been going on in the building. Of course, we're still providing dental services. We are looking at possibly having some adult walk-in days to get more adults into the building and to address some of the no-show that we've seen. Health promotion's been busy. I know we found out that we are going to be funded again, so we're excited about that. We also have gotten some updates on extensions of funding in Starting Point. I'm trying to make sure I don't miss any divisions. Environmental health's been busy. They've brought on in the last few months a couple new environmental health specialists, so that's great because we will have more people to support the initiatives of going out and being a partner and educating and also inspecting, of course. So just wanted to update you that. And then a few pieces of information, or a couple, I should say, that we did get that I think has been since the last Board of Health meeting. One was that we heard from a state representative that IDPH told her that Macon County is a model health department when it comes to vaccine administration, and I thought that was really cool to hear. And then another thing is we did have a meeting with the state, with Salesforce representative, and Salesforce is that contact tracing program that we had to adopt late last summer, early fall. And we found out that when it comes to metrics that the state is wanting to achieve for contact tracing, we were in the top 10 for the whole state and out of health departments. And then in comparably sized health departments, we were in the top 2 to 3. I thought that was phenomenal because to think where we were at early in this pandemic of, less than 7 people contact tracing, and now we've got, 70 to 80, when you include volunteers and all of the surge capacity that we have throughout the building. I just think that is phenomenal of what we've been able to accomplish in the past year with contact tracing. We did send out an update this week to the community, to the schools, to our stakeholders, informing that we were adopting the shortened 10-day quarantine for close contacts. Now, if someone's in a congregate setting, they are not allowed to use the shortened quarantine, and there are certain stipulations that go with the shortened quarantine, but we did decide to adopt that. I will say that was put out by the CDC and IDPH a couple of months ago as an allowance. The best recommendation and the best practice was still to do a 14-day quarantine to eliminate as much risk as possible of spread in the community. But you could adopt shortened quarantine if it helped achieve compliance in your community. At that time that it came out, our numbers were still not good. We were still losing residents of ours in Macon County. Not to say that all of it's over and not to say the pandemic is over, but we do feel like our numbers are in a better place now. And also when you look at things like the financial burden, the mental health burden that comes along with the longer quarantine, we did feel as if it was time to move in the direction of adopting that, which several of the counties around us have already done that. We did speak with them and kind of asked what their process was, how it was going, were they getting compliance? And so we did our due diligence before adopting. We felt like that was the right move. If we find that our numbers go in the wrong direction, then we can just go back to the 14 days. But I did want you all to know that we had done that and why. Any questions about anything COVID specific or any of the other things going on in our divisions? I hope you got to read the division reports because there's so much more going on than I can mention during this meeting. And our team, works really, really hard, even in a pandemic, to do everything that they can to serve Macon County. So I hope you got a chance to review that. And that's all I have.
Great, thank you. Any questions for Brandy? Okay, moving on, we have the presentation and acceptance of the financial reports.
Hi, everyone.
And Cherie is on to help out with that.
Okay, so we were able to get last year closed out in the old software and transfer the year-end numbers into our new software. So I have reports for December, January, and February for you tonight. Do you want to approve them individually or?
I think so. I think that'd probably be best, right?
Okay.
Yeah.
All right, so we'll start with December. So this is the first month of our fiscal year, so 8% of the year has passed. The ending fund balance was at 4.7 million. Then total revenue is at 372,000, which is 4.9% of budgeted revenue for the year. And total expenditures at 841,000, which is 11.3% of budgeted expenditures for the year.
Okay, great. Can I get a motion to approve December's financials?
I so move.
Motion.
Mary Jane.
Second, Vivian.
And a roll call vote, please.
Paige Toth,
Approve.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approve.
Candy Clevenger,
Approved.
Sue Kraus,
Approved.
Dr. Jurger,
Approved.
Dr. Menenganti,
Can you hear
Okay,
me?
is that it? Oh, there we go.
Yeah, yes,
okay,
yes.
There we
All
go.
thank you.
Okay, January.
Okay, so January 2021, we were 17% into the fiscal year. Ending fund balance is at 4.5 million. Total revenue, 713,000, which is 9.5% into the budget. And total expenditures at 1.4 million, which is 19% into the budget.
Okay, thank you. Can I get a motion to approve?
I
Phil, so moved.
Bill, go ahead, Bill. Since you're first.
So moved.
I second.
And a roll call vote, please.
Paige Toth,
Approve.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jurger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Yes.
Okay, moving on to February.
Okay, February 2021 is 25% into the fiscal year. Ending fund balance at 4.7 million. Total revenue at 1.6 million, which is 21.4% into the budget. And total expenditures at a little over 2 million, which is 28% into the budget.
Thank you. Can I get a motion on February, please?
I so move. Mary Jane.
Do I have a
Second,
second?
Vivian.
Thanks, Vivian. Roll call, please. Vote.
Paige Toth,
Approve.
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Approved.
And that was the last one, correct?
Yes.
All right, thank you
Yes,
so
thank
much.
you.
Yep.
Thank you, Sheree.
Next up, in your packet was the department expenditures. I would entertain a motion to approve paying the bills.
So moved, Vivian.
I'll second, Candy.
And a roll call vote, please.
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Approved.
Thank you, everybody. Brandy, it looks like next up we have grant applications for review, and are we voting on these?
Yes.
Okay.
And if we
I will
can
let-
do, yeah, if we can do these separately just for the minutes, I would appreciate that. I know it's another roll call, but we have a couple of them. So the first one is the 2021 Mass Vaccination Planning Grant. And this is the one that I mentioned to you last month that we knew we were getting funding in the amount of $275,000, but then they notified us later that we were going to get another $40,000 because we had implemented the EM track electronic system of being able to use the online platform, for people to register, and then they print a ticket, or we print a ticket for them if they don't have a printer, and that ticket follows them through our clinics and gets them checked out and everything. So we are getting the amount of $315,000. We have accepted that grant and did submit the grant agreement today, actually. So we just would like for you to approve that. As you can see, the answers are there on the sheet, but I did want to clarify, there was a question on there about, would this be duplication? Can anyone else do it? And of course, we're not the only vaccinators in Macon County, but we need to be vaccinating. And so it's great that we have obtained funding to be able to assist with that effort. And that's all I have on that one page.
Okay, great. I would entertain a motion to approve the 2021 Mass Vaccination Planning Grant.
I so move, Mary Jane.
This is
Second,
Sue.
Brett.
I second.
Okay, and then can we get a roll call vote, please?
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Approved.
All
Okay,
right.
and you have one more for us, Brandy?
I do. So this is one that actually came through Starting Point that Becky filled out for your review. And this is a vaccine assistance amount of funding. So this funding they were able to receive so that they could assist people that are in their program, seniors, people with disabilities, with signing up for vaccine appointments. And they have already been doing that. They've been a huge help. I will say one thing I forgot to mention is we do still have appointments open for our clinic this Thursday, and Starting Point has definitely been wonderful as far as taking the links for the registration, calling their clients, helping them get signed up. So we would just ask for you to approve that grant as well.
Thank you. Can I get a motion, please?
I so move, Mary Jane.
Thank you, Mary Jane.
Candy second.
And a roll call vote, please.
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Approved.
Okay, thank you, everybody. Your department division reports were in your packet as well. As Brandy said earlier, there's a lot of work going on, and we thank everybody. Does anybody on the board have any questions for anybody, or does anybody else present tonight have anything they'd like to add to the department reports? Okay. Next up is employee recognition. We have 3 this month: Sally Williams with 24 years, Kimberly Drabbing with 13 years, and Ashley Bond with 4 years. So thank you for your service. Moving on to old business, the approval of the annual report. Brandy, do you have anything you want to speak to on that before we vote?
Yes, I will. If you remember, you got the annual report last month. We did publish it last month. We did have to make a last minute update to that on, I believe it was Tuesday of our meeting, because of some changes that occurred at the county board level as far as who was on the county board, and that was, happening right there on that day or the night before. So we would like to just do a formal approval of that. That's not something that is required, but we want to just do it as a best practice so that we can show that you reviewed it, you were able to approve that for us, but that was published in a timely manner. So if anybody has questions, you can ask me, or Marissa's also on the call. But this is the same thing that you saw last month. We just wanted to go through the formal approval and ensure we had the proper one there in the packet and in front of you.
Thank you. Does anybody have any questions on the annual report? If not, I would entertain a motion to approve.
Vivian, motion to approve.
Thank you,
Mary Jane,
Vivian.
second.
Candy, second.
Thank you. And a roll call vote, please.
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Phil Tibbs,
Approved.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
and Dr. Menenganti.
Approved.
Great, thank you. Next up, Brandy, Board of Health member appointment update.
Yes, and really quick, I did just want to add more thing. Sorry that I didn't think to say, Paige, during the annual report. Our goal will regularly be in upcoming years to have that approved in February, the same month that we publish it. But I think there was something also with the wording on the agenda last month that it didn't say approved necessarily. So we always want to make sure that we're adhering to Open Meetings Act and making sure that we're not voting on something that doesn't clearly state that we'll be voting on the agenda. So in the future, we will, ensure that we do that in February. But I just did want to reassure you that it was published and everything when it was supposed to be. So anyway, just wanted to give clarification on that for moving forward into future years.
Yep.
All right, cool. So then Board of Health member update. So as you all know, we've been talking about the member appointments and member renewals for those of you that are due in May of this year. And I have submitted now 4 of the 5 of you that are due. There is that appointment form, if you remember when you first joined our board, that has to be submitted, and that also has to be submitted if we're asking for your appointment to be renewed. So those were submitted a couple of months ago and I hadn't heard back and they hadn't been put on an agenda. So I followed up and I did end up hearing back from the county board chairman last week, toward the end of the week, and he did state that the county board is looking to put new people on our board. He mentioned wanting new opinions and perspectives and fresh ideas is what he said in the email. I have not spoken to him via phone about it yet, but I'm not sure if that means all 5 of the people who are up for renewal or part of that group. I did contact the 5 that are up for renewal or termination in May just to notify them ahead of time. But I wanted all of you as the board to know that and kind of know where that was coming from. I don't know if I'll know who the candidates are or if I will find out when they're on the agenda for the county board's May meeting. But I was told by Jeannie, the board secretary, and I might have that title incorrect, but she follows up with me about appointments, and she did say usually they don't do the appointments until May. So I'm thinking I may not know anything specific until May, but as far as our board, we've done everything that we need to do as far as our regular process of approving the group, or the people whom we would like to have renewed. And thank you for turning your forms in. I really appreciate that. You all have been so dedicated and so supportive, and I'm so thankful for you. So, we'll keep moving forward. I don't know what's going to happen, but I at least wanted you to know what I knew. And if I find out more, or when I find out more, I will certainly let you know that. So if you have any questions, I'm definitely happy to answer the ones that I have an answer to at this time.
So Brandy, just one question. You said possibly May would be when it would be on the agenda. Would they also be potentially taking people to replace the 5 at that point, or would we be left with 5 vacancies then in May until they were filled? Do you know that answer? You may not know.
I can't say if he will be able to find 5 people by May to make the commitment. I will say, I got back with him and did, let him know that I have, the potential board member packet with the information about the commitment and the meeting times and all of that, and offered to be of assistance in any way that I can. But I don't know that I'll know. I would assume that according to their regular practice, they would appoint 5, whether it be some of you that would be renewed, or a brand new 5 if you're all basically not renewed. And I would think that he'll have them all ready for that May meeting so that we don't have a gap or an opening. I did remind him in that email that we are required to have certain types of positions on the board. We have to have 2 physicians, we have to have a dentist, and it's preferred in the act that we have someone with a mental health background. And so we have, I did remind him of that, which he's probably working with the state's attorney's office to ensure that we do meet the law and the requirements for that. But I did just want to make sure that that was remembered. So I don't think that he would let there be a gap. I would think that hopefully he'd put, someone on that's already on, but I'm not 100% sure.
Great. Does anybody else have any questions or comments? Okay. Moving on to new business, update regarding the Wits End hearing.
I did send a meeting or an email update earlier today that we did end up having to cancel the hearing just because of being unable to achieve quorum. I will say I apologize for the many, many emails, but one of the things that we've gotten some feedback on before was making sure that we reach out to our board as soon as possible if there's a hearing or a possibility of a hearing, to obtain availability and make sure we're holding that as soon as possible so that we're giving the business due process and we're getting them back open if they get back open, or just giving them an answer as soon as possible. We don't want to leave them open when their business, or leave them waiting when their business is not open. And so once we knew that they were revoked, before we even had a hearing request, I reached out to all of you with that first availability survey. And then of course, as I'd stated in the emails to you, we were just waiting to get some information back from legal because attorneys are involved in the hearings. And so we are kind of having to deal with a lot of different schedules and things to get this taken care of. And so I did hear from the attorney, I believe on Sunday, who basically said, yes, I can do it if you have to post it by 3 o'clock. So hence the additional email. So I'm sorry for totally filling your inboxes. I know you have plenty of other things to do, but thank you for your patience. Thank you for responding when I asked you twice when you were available. Thank you for, answering and responding to Sandy's phone calls. We did, let the attorney know today, as soon as we knew that we wouldn't have quorum, we notified the state's attorney's office and solidified that we would just follow next steps as far as ensuring that we got that business back open as soon as possible and went through the reopening process. Environmental health was great about kind of being on standby if that happened. And legal did let me know, just to document that in the file, that the reason they were basically that we did not keep the revocation of permit was because of not being able to obtain quorum and not because of anything else. So that documentation will be in the file as well. I did confirm with Kathy, they did get them opened back up today. So if anybody has any questions, I'm happy to answer them. Kathy's also on if you have some kind of specific question, but I just wanted to make sure you all knew what had happened with that.
Any questions? Okay, next up, we have approval of contract for infant early childhood mental health consultation services for FY22.
So this is actually a new contract and a new initiative within our McVie program. They've always had this type of support for our employees and for all of the employees in the program, but now they're basically going to contract it out rather than include it in the original grant or original contract agreement. So because it's such a new type of contract, we need that to go through legal and then all the steps of boards. So I'm going to present to you what the options are, and I will let you as a board decide how you would like to proceed. The state's attorney's office has not gotten back with me yet about any edits that they have to the contract. I went ahead and put it on the agenda because, as you know, when we have to go through this process and all these different meetings, this could take a month and a half to get a contract approved. Now, this is not until FY22, so we don't need this one, thankfully, until summer, but I thought if we approve it and it happens to need no changes from the state's attorney's office, then we can go ahead and push it to EEHW and move it along sooner. However, if you would like to wait until after legal gives us any possible edits, then we'll just push it out to the next meeting. I don't know for sure when I'll hear from them. I will continue to follow up just to make sure that we have it ready. But I think it's totally up to you how you want to proceed. Hopefully I've been clear about what the options are, but yeah, up to you. And obviously, if you approve it tonight and then there's changes that the state's attorney's office makes, I'll have to bring it back to you with those changes.
Does anybody have any input on that? I mean, my
I'd
inclination.
move to approve that contract. Sorry.
You move to approve?
I do move to approve that tonight. If we need to, after changes, we can do it again. But
I was going to say the same thing. I think that the major points of the contract are probably not going to be impacted by red lines by the state's attorney. It might just be some legalese. So I would agree that I think we should move forward with approval. And if there are significant changes, bring it back. But so we've got a motion. Do we have a second?
I second.
Roll call vote.
Paige Toth,
Approve.
Vivian Goodman,
Approve.
Mary Jane Linton,
Approve.
Phil Tibbs,
approve.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
Dr. Menenganti,
Approved.
and Dr. Patterson.
Approve.
Okay, thank you. Last item of new business is the approval of the Macon County Board Resolution authorizing disposal of surplus property by the Macon County Health Department.
Is it okay if I ask a question about the previous contract before I present this resolution?
Sure.
Okay, so I think what I heard you say, and I just want to make sure I'm clear, is if there are just small changes, I don't need to bring it back, but if there are significant changes, I should bring it back to you. Is that how you want me to proceed?
That's how I would envision proceeding. I don't know if anybody else on the board, Phil, I'm looking at you, if you agree with my assessment that sometimes legal minds just like to make little tweaks to the language to.
I do agree.
I do as well.
Okay. Yes. So technicalities we don't need, but if they change the substance in any major way or any of the significant terms or conditions, that's when I would want to see it back.
Okay, that makes sense. Thank you. And then this resolution is us just asking permission, and this would be similar to when we talked to you about donating the refrigerators and freezer. We have to take this through our board and then all of the steps of the county board process to obtain permission to dispose of our property. These are CPR kits that are expired, so we cannot do anything with them anyways. We have checked with the funder, we've checked with the American Heart Association, we've done all of our due diligence to ensure they cannot be used by anybody in any way safely, and they cannot. So we want to dispose of them, and we would just like your permission via approving this resolution to do so.
That sounds good. Can I get a motion, please?
I so move.
And a second?
Brett, second.
And a roll call vote.
Paige Toth,
Approve?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approve.
Phil Tibbs, Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved.
and Dr. Patterson.
Approve.
Thank you, everybody. And it looks like we do not have a closed session tonight. Is that correct, Brandy?
That is correct.
So that brings us to the end of our agenda, and I would entertain a motion to adjourn. Nobody wants to leave. We're all-
This is Sue, so motioned.
Thank you, Sue.
Second.
Thank you. Can I get a roll call vote?
Paige Toth,
I approve.
Vivian Goodman,
Yes.
Mary Jane Linton,
Approve.
Phil Tibbs,
Approve.
Candy Clevenger,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved. Thank you.
and Dr. Patterson.
Approve.
All right. Well, thank you, everybody, and have a great night and a good rest of your week, and we'll see everybody next month.
Thank you.